Hello, everyone. Thank you for joining us today for our Advocacy Update webinar. I'm Joe, I'm the CEO for Mission MSA, and I'm joined by Josh Fine today, our Washington representative, to talk about our current advocacy and government affairs work, things that we've done, and things that we're really looking forward to for 2026. And so Josh is going to kind of walk us through some of our priorities and our upcoming work. But as we go through this conversation, please feel free to ask any questions you might have through the Q&A function in Zoom, which will be at the bottom of your screen. We'll try to get to as many of those as possible after Josh's presentation. So with that, I want to go ahead and toss it over to Josh, who's going to kind of provide us with a brief overview and update of what's going on in Capitol Hill. So over to you, Josh.
Great, thanks, Joe, and thank all of you, for joining us, today. I'm just going to share some presentation slides. Hopefully everyone can see. So this is just going to be, pretty straightforward update on, upcoming activities, what's been going on in Washington, D.C., what's most important for the MSA community. But then at the end, if there are any questions, that you all have, me and Joe, will be happy, to answer. So first, we're going to start off by highlighting, an event that we're very excited about that's coming up, in March, in about a month from now. So last year, as some of you who may have joined us on Capitol Hill, as you can see, in this picture to the right, we had our first annual Advocacy Day. This is attending, congressional meetings, on Capitol Hill, coming from, your hometown and meeting with your members of Congress, your senators, your representatives, and discussing, what's important for our community, discussing your experience as a patient, as a caregiver, and ultimately making our voices heard. This is a part of our, grassroots advocacy strategy. Last year, I think we had around, 8 folks who were able to join us, and I know that we already have more registered this year. But certainly, if anyone is interested in, being with us on the Hill on March 24th, and a reception on March 23rd, the day before, please reach out to Joe and other contacts at Mission MSA who can provide you with more of the details and logistics for the event. But certainly we're very excited for this, and we're going to be continuing to advocate for our key priorities, around the National Institutes of Health, medical research, public health, patient access to care, items that we've been advocating for in the past year, but want to continue to expand our outreach, making connections to new members of Congress, new congressional offices, and really making the MSA community heard overall on Capitol Hill. So first, we'll just start off with a quick Washington updates. What has been going on. We're now in the second session of the 119th Congress. As you all know, Congress is split up into 2 sessions, the first one and then the second session for 2-year, terms for the House of Representatives. So there are going to be midterm elections, coming up. But for the first half of the year from now until July, Congress is very much going to be focused on the appropriations process and also the issue of access and affordability around the Affordable Care Act, premium tax credit subsidies. So where are we at right now? So the fiscal year 2026 appropriations process, as some of you may have seen recently in the news, that process for all intents and purposes for the MSA community recently concluded on February 3rd. That was when Congress finalized the appropriations bills or the spending bills for the Labor, Health and Human Services and Education departments, and also the Department of Defense. So medical research at the NIH, public health funding at the CDC, every NIH institutes, every program within the Department of Health and Human Services has a budget that was finalized by Congress and then approved and signed by the president that is now enacted into law for fiscal year 2026, which runs until the end of September. I'll detail some of the specific highlights for the MSA community in a moment, but for HHS, that process is completely concluded for fiscal year 2026. But now Congress is swiftly shifting its focus towards the beginning of the fiscal year 2027 process, which is starting right now as congressional offices are starting to listen to groups like MSA on what our priorities are for the next fiscal year. What do we want funding wise? What type of language do we want including in the spending bills? But all of that is going to be beginning from now until around May, which makes our visits in about a month from now, very timely that our voices are going to be a big part of the conversation as, they're competing on how much funding to give for DoD, how much for the Department of Health and Human Services and various agencies. And on the issue of access and affordability, the appropriation process was a major focus of around the first month of the year, finishing off FY26. But alongside working on FY27, they're going to be considering various solutions to the issue of the expiration of the Affordable Care Act tax credit subsidies that didn't expire at the end of 2025. So there's been multiple proposals that have been on the table that have ranged from a 3-year extension of these subsidies to maybe a 2-year, 1-year extension. But the House had passed a 3-year extension a few weeks ago. Now the Senate is working to come to a bipartisan compromise. But we expect some action, on this issue as, we've been hearing stories about patients in general who have healthcare premium costs that have, rise significantly. So this is going to be an ongoing issue that Congress is looking to address, in the next few months, along with getting FY27 done, as well. So what were the key highlights in FY26 that's really important for our community? So number one, big victory for NIH funding. Congress approved over a $400 million increase for the National Institutes of Health, which, as you all know, is the leading biomedical research agency, not just in the United States, but really the entire world. And NIH's budget is almost $50 billion, 50 billion with a B. So they got $400 million additional money for FY26. And the NIH Institute that primarily takes the lead on multiple system atrophy research funding is the National Institute of Neurological Disorders and Stroke, or NINDS. So along with the NIH receiving top-line funding for the overall agency, the specific institute, NINDS, did receive additional funding as well for FY26. What does that mean? That means that there's more money to go around for all conditions, but including MSA, as well. For the Centers for Disease Control and Prevention, that's the main agency that does the work on public health, activities, education, and awareness across the country. So funding for that was around level funded. And then the Food and Drug Administration, their budget actually was finalized back in November when Congress ended the government shutdown. But they also received, a small increase, at the FDA as well. But I think the main points, from the FY26 process is that there's been a lot of headlines in the last year about, unfortunate cuts to research that have happened, but also proposals that the administration had sent to Congress asking for dramatic, draconian cuts to medical research, cutting NIH's budget by, very large percentages, and also reorganizing and reshaping the entire Department of Health and Human Services. But with these spending bills reinforced is that Congress didn't have much interest in that. Congress was very supportive of NIH and medical research. They didn't want to consolidate NIH institutes and put NINDS, with another group of diseases, that are not connected to neurological disorders. And they essentially maintained the status quo on what's been going on at all of HHS, but at NIH specifically. So instead of approving huge cuts, Congress gave increases and completely maintains the current structure of the massive department known as HHS. Another great thing that was included in the FY26 bill was language that we worked to get included in the House and the Senate appropriations bill, highlighting multiple system atrophy. So what this language is essentially their congressional instructions or recommendations that Congress sends over to all those specific agencies, the NIH, the CDC, the FDA, really highlighting things that they care about and highlighting areas that they hope, that these agencies, will give more attention to and work on. So for us, we got language included in the bill that specifically highlights MSA and our connection to Parkinson's disease, but also talking about the need for research and implementing the National Plan to End Parkinson's, which was a piece of legislation passed a couple of years ago that now the NINDS, is working to implement. MSA is a part of that National Plan to End Parkinson's. So this language, now that Congress has approved it through the FY26 spending bill, is official language that the National Institutes of Health, by law, they have to respond to this. So our expectation is that when the president releases, the budget request in the next month or so, that there's going to be some response on the National Parkinson's Plan, and MSA specifically. And if there isn't a response, we can work with congressional champions to highlight the language, send a letter to NIH, simply asking for an update on what's been going on to implement the language. While we're very happy that this was included and adopted by Congress, we don't just want it to be a book that goes on a bookshelf and then nothing ever happens to it. We want to make sure that NIH, is responsive to what Congress has directed them to do around MSA and around this national plan to end Parkinson's. Now, for fiscal year 2027, we're going to be asking once again, for, key priorities that are important to our community. While we're happy that Congress gave a $400 million increase for NIH, the current budget is still only around $48.7 billion. So for this year, the wider medical research and patient advocacy community is asking for $51.3 billion for FY27 for the NIH, along with a proportional increase, which we would like to see again at NANDS. And for the CDC, we're going to be asking for $11.6 billion, which is also joining with the wider community, ask, for FY27. And we're also going to be requesting $6.5 million for a program called the Chronic Disease Education and Awareness Program, which is a program at CDC that is intended for chronic diseases, such as MSA, that doesn't have any specific line item or directed work going on right now. So this is a program that we're very supportive of, and we hope that as it continues to grow, that one day we might be able to apply for a grant through it and receive funding to do education and awareness activities, across the country, educating both patients and providers, about what, MSA is and all the challenges, and everything that goes into a diagnosis. And lastly, we are still supportive of the Healthy Brains Act. This is a piece of legislation that is slated to be introduced by Representatives Subramaniam and Gus Bilirakis from Florida. These are the members who have been supportive of the National Plan to End Parkinson's in the past. Jen Wexton, who has PSP, she helped get that legislation passed in the previous Congress, the 118th, with Representative Bilirakis, and Representative Subramaniam took over her district. So we know that they're planning to reintroduce the legislation, but they're still working out some things behind the scenes. But it is a bill that would basically have HHS start doing more research into specifically environmental factors that contribute to neurodegenerative diseases, like MSA and others. So, we're just waiting for it to be introduced. But another bill that we're going to be highlighting during our Hill Day in March, talking about why, it's important, specifically, for the MSA community. That was all I had as a formal presentation. But happy to answer any questions that you all may have about research funding, the state of things in Washington, or just our advocacy day, in March.
Thank you so much, Josh. Appreciate it. One of the questions I see from Tina was the 50 billion, I think she's referring to the NIH for Parkinson's as a whole or MSA. This is for the NIH, right, Josh? So
Yeah.
Okay.
Yeah, so the NIH budget, consists of many different things. So there's 27 different centers and institutes that are all together under the umbrella of the National Institutes of Health. The total funding for the entire agency is over $48 billion. But for MSA specifically, that budget, depends on, the number of, just grant applications and that were approved, by the National Institutes of Health. So the NINDS, they have a budget of around 2.8 billion, I believe. So it's one of the larger institutes, at NIH. But NINDS coordinates research funding for many different conditions. So they're also taking the lead on Parkinson's, PSB, other neurological conditions, movement disorders. So they're getting applications for all these different, kinds of research funding. But what we want is the largest possible top line number, so that there's more money to go down the line. So an overall increase for NIH and NANDS is going to benefit our community because there's more money to go around, but it's also going to benefit other communities as well. That's why we join with the larger patient advocacy community, advocating for this specific number, to show that, whether you're MSA or Parkinson's or another disease group, that we know that more research funding for everyone, benefits all the disease communities, and especially rare disease communities, that historically haven't had, as much resources dedicated to it. So that's why our approach is advocate for the most money from the top down. And the theory is, the a rising tide, lifts all boats, essentially.
We have another question asking about the Credit for Caring Act, which gives working caregivers a $5,000 federal tax credit. Have we given any thought to this? It looks like ALS, as an example, is a disease state that is supporting this legislation.
Yeah, so it's a bill that we're familiar with. I know that the Alzheimer's community is very supportive of this. Yeah, it's a legislation that we're aware of. It's bipartisan. I think it's got a few dozen co-sponsors, and yeah, seems to be very reasonable. So happy to discuss it with you, Joe, and adding it to our legislative agenda. But yeah, absolutely a bill that I think makes a lot of sense. And I know that the rare disease community next week is going to be advocating for that. At Rare Disease Week. So yeah, I think a very strong bill. Wouldn't have any issue, adding it to our list, for March, but just something, we would have to, figure out ahead of time.
All right, wonderful. Um, Tina had another question around are we targeting pharma or just government funding? I'm not entirely sure or what the question is around targeting of pharma, but certainly we are approaching the government piece of it to set aside resources that would advance work that would meaningfully change and support multiple system atrophy research, care,
Yeah.
etc. But is there anything you'd like to add, Josh?
Yeah, I'll just say, yeah, I think it's a good question. Joe can speak a lot more to the connections and the work that the organization does with a lot of pharmaceutical companies, biotech companies that are pursuing, clinical trials and other initiatives to advance research. But when we're going to Capitol Hill, we're not saying, give Merck, more money. We're asking for the starter level, basic level research at NIH that ultimately, as researchers will attest to, ends up being the foundation for the treatments that get passed along to patients and approved at the FDA, sometimes literally decades later. So we're going there. We're not asking for money for pharmaceutical companies. We're asking for more money that the government, via the National Institutes of Health, gives out to various researchers throughout the country. Um, Once we get that funding, then we go and tell MSA researchers everywhere, hey, there's more funding, go apply to the NIH, submit great applications, do great science. But we're getting that funding so that we can ensure that the basic level research that ends up leading to the transformational breakthroughs down the line, that Congress continues to support that, because ultimately not every treatment, unfortunately, that goes through clinical trials ends up working out, which is why we need a continuous and growing stream of research funding to ensure that we're covering every possible base and doing everything we can, to find that innovative treatments, that no one had ever discovered before. So yeah, essentially not asking for any form of money, just asking for more congressional, taxpayer funded dollars to be going to medical research and
Right.
health.
And I think when we think about pharma, this may be slightly tied to the question, but when we talk to agencies and we talk about clinical trial development process, and we're talking about meaningful outcomes that connects to trials and accelerating trials, especially for a disease like ours, that's certainly something that we are hitting on quite a bit, and we have plans to inform the FDA even more so on our disease state, therapies that are being explored, and why accelerating the process is so meaningful for those living with MSA. So that is certainly something that we do as well. It's very much tied to this work. Dean had a question around if Reverend Jesse Jackson passed away today from PSP, if there will be more light and awareness on PSP MSA in Congress. What do you think, Josh?
Yeah, my answer is that, we work with the Parkinson's community, very closely, and Michael J. Fox, And yeah, they really, they've done a great job, but we're teaming along with their efforts. But I think, yes, absolutely, there's a great general awareness about Parkinson's, about PSP, which Congresswoman Wexton had in the national plan. Then Parkinson got enacted during a Congress when simply not many bills had been enacted. So it shows that, similar to ALS, it's a condition that's very well known. But I think our job, for our community is noting that, yes, we're happy to be a great coalition partners and advance, treatments that could potentially work for both conditions. But we need to be educating members about why our community has different needs, and MSA is ultimately has similarities, but critical, differences between these other communities. So our job is educating specifically around MSA, and your patient experience, because you're right. Members of Congress and staff members who we're meeting with, they almost certainly have heard of Parkinson's. They've probably heard of PSP, but they may not necessarily have heard of MSA. So that's where we're filling in that gap specifically for our community on that education and awareness piece, that we need to be part of the conversation as well, because our community has unique needs that the others, simply don't.
Yeah, and I think this also speaks to the importance of us going to the Hill and kind of aligning ourselves with, like Josh said, many know what ALS is and many know what Parkinson's is. But when we say atypical or Parkinsonian plus, that's when there's really an opportunity for us to illustrate to them that there are these other diseases that are kind of thrown under this umbrella terminology. And it's important for them to understand, yes, we share many similarities, but there are key differences. And kind of understanding both sides of that coin helps them understand why advancing one piece of legislation or regulation may benefit all of us. One may be more specific for MSA because we have that uniqueness that we need. And so going to the Hill, I think this is one of those time and places where sharing your story, sharing your lived experience really highlights and illustrates, colors in the line. When we say, what is multiple system atrophy? It is an atypical Parkinsonism. The alphabet soup can kind of get lost a bit, but when we are there and we have the opportunity to meet face to face, it's incredibly impactful. And I think that's ultimately what we felt led to the language being included. And so it's really critical that we certainly want to be a part of that tide. And we also want to make sure they know that we have a specific wave in the ocean, as it were. Amelia has a really good question. Is MSA currently and explicitly recognized as a chronic illness? Do you know the answer to that, Josh?
Yeah, I would defer to you, on that question, but I do think that's like absolutely, like with the CDA, for example, I think that we could, write a strong, application for that.
Yeah, absolutely. And it, by definition, it certainly is. And I think it gives us an opportunity, like Josh was saying, when we were pushing for the awareness aspect, it creates an opportunity for us to align or apply for potential funding to raise awareness, which we all know is so vital for MSA to the greater public. So absolutely. Gene had a question, and I see some really familiar faces around those who have visited us on the Hill before. And maybe just to roll this in, for those that have never done a Hill Day or are thinking about it but have never actually done one before, it can be an intimidating terminology. Can you kind of give us a little bit of background, like what should they expect from the experience? What do they need to prepare for? What do we at Mission MSA provide to them? Anything around, I think that would be really useful for those that are on this call.
Yeah, yeah, of course. Yeah, so the main thing that, we always tell advocates, and I, have the privilege of working with over a dozen different patient communities, is that ultimately, your story matters more than anything. I talk to congressional offices a lot, so do my colleagues, Phil, and, others at my organization. But ultimately they want to hear from you, and they want to hear about your, diagnosis journey, or if you're a caregiver, and they want to hear about issues local to their community. So the number one thing, for coming to a Hill Day is just knowing your story and being able to share your story, and knowing that you're not going to be judged, by staff members for not being policy experts, because they know that that's why, Mission MSA hires, organizations, such as, the one that I work for. But for the actual logistics of the day and preparation, we do everything we can to make it, as smooth a process as possible. So this year we're going to be having a nice reception at a nearby office in Washington D.C., where we're going to have a dinner, but we're also going to be doing specific training for the advocacy day. So the day before, what you can expect is that one, you're going to meet all of your teammates. So you're going to be going in groups of probably around 4 to 6 individuals. And all of you will have a staff member who's either myself or colleagues of mine who are experts, at policy and can answer any questions, that staff members might have. But you get to meet everyone, but you're also going to receive your schedule. So you're going to see that if you're from Illinois, like Joe is, you're going to be meeting with Senator Duckworth's office and Senator Durbin and Representative Schakowsky, or Quick, whichever one you are now.
Quickly. Yep.
Yeah, because it changes a lot. But you're going to be meeting with some other states as well. So it might be Illinois and Wisconsin. But you're also going to be meeting with senators and members of Congress who represent your specific area. Or they're going to know the whole town that you live in when you come into the office. So the main thing is sharing your story. But we're going to go over all of the legislative priorities, and much of that is going to be similar to what I just presented. The specific number for NIH, the specific number for CDC, any relevant, pieces of legislation that we want to be supportive of, whether it's the Healthy Brains Act or if we add the Credit for Caring Act as well. All of that information will be provided to you and will be discussed at length in the training. But then we will also send out what we call a prep packet, which has medical research talking points in greater detail, usually around 10 days to 2 weeks in advance. So that's another document that you can prepare for and we'll go over before you even go to Washington, D.C. And then on the actual day of the Hill visits, we generally convene nearby Capitol Hill, probably at my organization's office, which is a 10-minute walk from the Capitol. Then we'll walk to the Capitol. We'll have a nice group photo like the one that was just shown before. And then we all split up into our different groups. We'll probably have Senate meetings in the morning. So we'll have 3 to 4 meetings that last around 20 minutes long. And we'll also go through, how exactly a congressional meeting works at the training the day before. So we have meetings in the morning, a few meetings with senators, from around 10 a.m. maybe to noon, stop for lunch. And then we walk over to the other side of the Capitol, which is where the House of Representatives office are. And then we do the same thing. We meet with, instead of senators representing 15 million people in Illinois, you're representing, you're with a member of Congress that represents around 700,000 people. But that's your specific district, not your entire state. You do the same thing. You're sharing your story. We're talking about the legislative issues. We do that for a couple more hours in the afternoon. You have around 6 to 8 meetings probably for the entire day. And then we conclude and everyone goes to the airport or back to their hotel and then on, with their lives. But we make everything as straightforward as possible, providing you the advanced talking points, ahead of time, giving you that training on the day before, and then having government affairs staff leads such as myself to help facilitate the meetings and fill in any key policy details that might have been missed.
Yes. Well, and we're here to make it as easy and as, like Josh said, as straightforward as possible. If we'll provide you with all the training materials and orientation that he just went over, but if you want to have additional conversations or want to feel extra prepared, we are more than happy to have conversations, email exchanges, whatever it is you need to make sure that you feel comfortable. I mean, at the end of the day, it's telling your story. I mean, that's what it is, and so it's incredibly important. We have a question, and this is, I think, a really interesting one that I don't think we'll have a precise number, but there was a question, when we think about how big the need is for multiple system atrophy and the resources required, and I'm assuming this question is kind of moving towards symptom management or maybe a therapy or disease modifying. How do we narrow, what's the gap between prevention and a cure to where we are now? And I think I'll toss it over to Josh. I think it's a really difficult thing to put a quantity around. It's a great question though, and it's very relevant to the work that we're doing. I suppose my only real comment here is I think what we're looking towards, and Josh again can provide some additional color, is I think there are other disease states similar to us, perhaps in rarity, severity, and progression that we're looking at. I think we can see where some successes have been from different communities, Now, they may not have necessarily found a cure per se, but they've certainly been able to resource where they have been able to try different trials. They've reached some things have finally come to market, which certainly are not going to be the end all be all, but we have certainly seen some success. So I do think there's a roadmap out there that we're looking at. It may not be an absolute prescription in terms of the footsteps that we'll follow, but I do think there are other diseases that certainly we're examining. How did they get here? And I will say, certainly from what we've seen, it takes a while. This is going to be a marathon. It will not be a sprint, but we've seen people, organizations, diseases reap the rewards of being consistent, showing up, educating, advocating consistently, and ultimately seeing some real fruition come through from resources allocated by the federal government. And so, Josh, I don't know if there's anything else you might want to add.
Yeah, I think I'll just add is that, I've, my organization, the Health and Medicine Council, we work with a lot of rare disease groups, and, rare disease groups that are in different states. Unfortunately with MSA, we're at a state where we're trying to find the initial breakthrough treatments with both symptom managing and disease modifying. But we've had, the great honor of being with groups that have had those breakthroughs and went from a condition with 40% mortality to, being able to live a normal life with 7 FDA approved therapies. So I think the answer is, as Joe said, it is absolutely a marathon, and to not get discouraged because these things do take a long time, but ultimately it's done through the advocacy process, through joining with the larger coalitions, advocating for more research, but then getting these specific recommendations and, idiosyncrasies, and specificities for our community that show that we're different, and also educates not only Congress, but also working with agencies and NIH, which is why we met with NINDS last year, to fill in where are the gaps, where are the additional opportunities to do more that can really advance, MSA treatment. So that's what we've been successful with other rare disease groups. But ultimately, all we can do is give opportunities to the great scientists that we have, working in the communities. But the more we educate NIH, the more we educate Congress to be creating additional opportunities. And I think the National Parkinson's Plan is a great initiative, that Congress implemented, and now NIH, has to, move forward with that. I think that's a great example of, the legislative process, in action, and we hope that there'll be great, results that, end up yielding from that, eventually. But yeah, the answer is it does take a long time, but through persistent advocacy and specifically including the recommendations for NIH in the spending bills every single year, so that every time NINDS program officers and leadership goes to the spending bill section, they see MSA listed. And, trust me, if you go through the bills, most neurological conditions are not listed there. Most aren't. A lot of times there's maybe 5 or 6 pieces of report language in the NINDS section, and 2 of them might be with, conditions that our organization works with. So that's why we're doing this work behind the scenes to get this language in. And that's why we advocate for them, so that NINDS, keeps hearing about the need to do more for MSA, not just 1 year and then we stop and go home and applaud ourselves, but continue doing it every single year.
Absolutely. We have a couple questions around mobility during Capitol Hill Day. Can you talk about those that may need a wheelchair,
Yeah.
other assistance, and how easy or difficult is it to get around the Hill?
Yeah, so there is a decent amount of walking that has to be done, unfortunately for congressional meetings, but there are resources available. So we have worked with companies in the past and organizations to get scooters or wheelchairs that are delivered to our office ahead of the meetings, and then you simply use them for the day, and then return them, and then someone picks them up, when you're done. So we can absolutely arrange for that, but if you're planning to come to the Hill Day and you need, this kind of assistance, I'd recommend reaching out to Joe and others from Mission MSA, letting them know that you need it, and then we can work together, with Joe to make sure that we've got some wheelchairs or a scooter, at our office or at whatever location is most desirable ahead of the meeting, so that everything, is good to go. But absolutely, if you need a scooter, that's perfectly fine. You're allowed to take them into the building. Same thing with a wheelchair. There's accessible entrances. The buildings have, the ADA capabilities. So, definitely something that can be hands-on. We would just need to know about them ahead of time.
Absolutely. And I hope this answered questions around some of the wheelchair and accessibility pieces. If you have any specific questions, like Josh said, please feel free to contact Mission MSA, and we'll be sure to coordinate and make sure that you have everything you need the day of our Hill visit. All right. So I think that those are all the questions that we have, Josh. Thank you so much to everyone for attending today. Hopefully it was informative. We hope that if you are on the fence, you'll consider joining us March 23rd and 24th in DC as we continue to grow our Capitol Hill event and raise awareness for MSA. And so with that, if there's nothing else, we will hopefully see you all soon. And always feel free to reach out to myself. Our info at email is always readily available and checked. So if there's anything that we can ever do to support you, we'll be happy to. All right. Thank you so much. Take care.
Take care.